Well, a lot of Republican governors across the country are furious at Washington for botching on a health care rework. Rare is it to see a governor like the one in Maine go after his two state senators for contributing to that. But that's exactly where Governor Paul LePage is coming from, saying that his independent Senator Angus King and Republican Senator Susan Collins botched an opportunity to do just that. Governor, very good to have you.
It's a pleasure to be on.
All right. So your argument with them is they dropped the ball. Explain.
Absolutely. You know, Senator Collins has no experience in dealing with deficits, but Senator King, when he was governor, he created a $1 billion structural gap. He had a $750 million debt that he did not pay to the hospitals that I had to deal with when I came in. Plus, we had another $250 million budget shortfalls every year in Medicaid. Right now in Maine, we are the oldest state in the union. We have the highest premiums, we have high deductibles, and insurance is unaffordable. We are the oldest population, and therefore, whether or not they agree with the Senate bill is irrelevant. The point is, you've got to continue the debate because we've got to get an answer. In January of next year, we will not have any insurers in Maine that will insure the private markets, the individual markets. So we need some help. And I think had they passed the bill, it would have gone to conference. There's much in the House bill that is very, very good. In fact, much of the House bill is designed after Public Law 90 that we put in play in 2011.
But by not voting for the skinny repeal, they didn't advance that. Now, what's interesting in this is Senator King is an independent, but I guess he votes mostly with the Democrats. And Susan Collins, of course, has been consistently voting against any of these Republican efforts, including the repeal measure. So what are you left to do now? And, of course, they seem to talk a lot about revisiting this, but you've talked about working for those benefits in Maine, right? Could you explain?
Right. What's happened in Maine is we created some wait lists of elderly, disabled, and mentally ill patients because there's just such a big deficit. And so what I'm saying, they expanded Medicaid in 2002 in Maine. We have 15 years of history. We know what's happening in other states now. We have the history of what's happened in Maine. So we need to deal with this issue. Obamacare will falter on its own. We have opportunities to improve the lives of American people and certainly Mainers by addressing health care in America. And
but how would it work, Governor? Because the way it's explained to me is that your state's version of Medicaid would require sort of like what they did years ago for work to welfare, that kind of welfare to work?
Yeah. What we do is we're saying that able-bodied people between 19 and 50 have to have skin in the game. Free is expensive to somebody, and usually it's for the rest of the population. So we're saying we want to have a safety net for our elderly, our disabled, our mentally ill, but if you're an able-bodied person going to work, you have to have skin in the game. And that's all we're saying. We're not saying you can't have subsidy. We're not saying that, but we're saying it can't be free.
All right. Now, this has already been branded. I mean, and you're used to criticism from the press, obviously, but that as a heartless measure, and you've been dealing with that. How do you react to that?
I react to this way. My colleagues in the Democratic Party in the state of Maine have a wait list. I removed the wait list in my last two biennial budgets, and they refused to fund them. I'm not the heartless ones. Their priorities are not on the elderly, the disabled, and mentally ill. Mine is. That's a high priority for me. I'll tell you, Neil, anyone that says that paying a little bit, or for instance, in Maine, we assign, when a person uses the emergency room, we assign a medical family physician. If they go to the family physician, it's free. If they go back to the emergency room, I think they ought to pay a $25 deductible if they refuse to use the physician that's been assigned to them. That's all we're asking. We're not trying to be draconian here. We're saying everybody's got to have skin in the game. You got to participate. And by getting involved, and you know, some people in Maine are getting premiums of $1.75 a month. I don't think that's too much to ask if you're working.
Yeah, especially for states and localities that can't afford to keep paying that exclusively themselves. But it looks like a healthcare rework looks next to nil to get done. How do you feel about that, moving on to tax cuts in Washington and just dropping the healthcare thing altogether?
Well, if you do that, the next year, the state of Maine won't have any insurance carriers in our state. And that, who's going to do it then? Is it the federal government going to fund? Are we going to start an insurance company at the federal level, and like we had to back in 1992? If they want us to do that, I'm all in. But give me the authority to set up my own insurance company. We'll capitalize it and we'll sell insurance. But we did it. We have a company called Mimic. We had to do it in 1992 when all the insurance carriers left the state for workers' comp. So we set up our own system. If they gave me the authority to do that, you'd never hear another word. I'd go to work and I'd get people insured.
Governor LePage, very good seeing you. Thank you very much.
It's a pleasure to talk to you, Neil.